So let me just do a quick welcome for everyone. For those of you who don't know me, my name's Tony Bridges. I'm one of the assistant directors with Source. We're the Community Engagement and Service Learning Center for Johns Hopkins. And this is, for those of you who aren't aware, National Volunteer Week. There are a number of activities that we are doing throughout the week to show just how much we've engaged in Baltimore, even during a virtual year that we've been having because of the pandemic. I know that a lot of people have switched from doing things that they would normally do in person, teaching in person, volunteering in person, but things are a little different now. And so we've gone into this virtual world, and as the world has adjusted, so have we. And so because of that, we do want to make sure that we highlight the work that folks are doing in Baltimore's communities. And so today, we've partnered with the Anna Baetjer Society for Cross Section, which is sort of, if you've been working with the Anna Baetjer Society over the last couple of years, they've done something called the Suite Seminars. Suite Seminars have transitioned to what is now Cross Section. And we are more than excited to partner once again with Anna Baetjer Society to bring to you Cross Section today. Just a few notes. Let's see. In the chat, I just posted our volunteer activities that we are going to be doing throughout the week. Just again, for National Volunteer Week, as of tomorrow, this is the event, the only event that we have going on today. Tomorrow, we got the Volunteer Appreciation Award Ceremony. That is, if you go to the website or if you've been invited, this is an opportunity for us to acknowledge the work that some of you or your peers have nominated you for the work that you've done in Baltimore's communities. We also have the Source Service Scholars poster session tomorrow. If you're not familiar with the Source Service Scholars, it's a academic year program that Kiala Jacques, who's one of the assistant directors also with Source, who's also on here, she and I co-facilitate, where we actually work with scholars and CBOs to match you up to be a program manager. There are a number of nonprofits in Baltimore City that we work with that really need assistance to get things off the ground. And we work and sort of pair you up with those community-based organizations. And it culminates at the end of the year with a program, a poster presentation. So that's actually going to happen tomorrow. Thursday, for those of you who have been doing service out in the community and you have not reported your service just yet, you will get a number of emails you'll see on social media that we want you to report your service. That really helps us to know what you're doing in Baltimore's communities, how you've been serving, and what we can do to make sure that you're having a really good experience with community-based organizations in Baltimore City. So we want to make sure that you report your service on Thursday. And finally, on Friday, we're going to have a partner panel. We actually on yesterday had a film screening about immigrants and refugees, and the film screening was really good. Number of people participated, and on Friday it's going to culminate with a panel discussion on serving immigrant and refugee neighbors. And so if in the chat you should see that I've given you a link to the website where you can find all this information, so please feel free to go ahead and register for any one of the activities that we have throughout the course of the week. And with that, I am now going to turn it over to Laura Haskins, who's going to lead us into the cross section so that you can hear about the volunteer experiences that your peers have done throughout Baltimore's communities this academic year. So with that, Laura, I'll turn it over to you.
Thanks, Tony. And I just want to echo what Tony said. Thank you for all coming. Welcome to this event. For those who don't know me, my name is Laura Haskins. I'm an MSN MPH student, and I'm also one of the student leaders for the Cross Section series, and I'm on the executive board of the Anna Baetjer Society. So Cross Section, for those who haven't heard of it, is really a student series that was created by a group of MPH students trying to create a platform for students to meet, connect, share, and learn from each other, especially in this virtual world where that's been so challenging for everyone. So this is a special session of that series where we're partnering with Source to really celebrate National Volunteer Week. So today we have 3 students who have volunteered with the Baltimore community, and I'm really excited to hear from all of them. So just the format of this event, what we're going to do is give each presenter about 10 minutes to talk about their volunteer experience. And what we'll do is save question and answer until the end after all 3 students have presented. So just write a note if something comes up or put something in the chat if you'd like, and we'll get to all of those questions at the end of our time. So that's really all I had. I'd love to get started, and we'll begin with our first presenter. Elle, please take it away.
Hi, so my name is Elle. I use they, them pronouns. I am a first-year MSPH student in the International Health Department, focusing on social and behavioral interventions, as well as humanitarian health. And back in, I guess it was August, I got one of the emails from one of the many emails for incoming students that was giving more information about the Johns Hopkins Health Education and Training Corps, or Hopkins HEAT Corps. And it looked like a really cool opportunity, primarily because, one, I was moving to Baltimore and new to the area and had some hopes that we might eventually go in person. But, and I thought it would be a great way to just get engaged with Baltimore youth and continue teaching. Prior to coming to Hopkins, I was working as a Peace Corps volunteer in Mongolia. And while I was there, I was doing health classes, focusing on sexual and reproductive health, as well as nutrition and a few other things that was in the national curriculum. And so I just thought it would be really cool to get involved with the HEAT Corps, because my time was cut short volunteering in Mongolia due to COVID. And it was just, I got very excited, honestly, when I saw that there was an opportunity to work with students again. And I will say that doing it virtually has definitely been a very fun and interesting experience. So basically, the content has been focusing on how to model social distancing, hand washing, mask wearing, and also now we're transitioning more into what the vaccine is and myth busting, just so that students, both starting from primary school all the way through high school, have a better understanding of what COVID is and how we're going to move forward. It's been super interesting doing it on Zoom, because kids on Zoom for 8 hours a day, I mean, in grad school, it's been rough. And so I can't imagine. I had the attention span of like a squirrel in middle and high school and did not want to pay attention, especially when it was a guest speaker at some points. So it's definitely been interesting to try and teach 30-minute sessions that sometimes, especially when we were going into like symptoms, the students weren't always that interested, but it was really cool just to see how, one, the questions, I mean, when you're working, especially with primary school students, they're going to have the weirdest questions for you. And it honestly was a great breakup from the very serious seminars or classes or lectures I had in grad school to go into like a 5th grade or 7th grade classroom and just talk to the kids and hear their questions and see what they were actually interested and worried about. Because at the end of almost every single session, we would just open the floor to them and let them talk about what they might be worried about. Before the vaccine came out, that was really the focus of all their questions. They wanted to know when they could go and play with their friends again. And so it's just been a really cool experience, especially being new to Baltimore, to meet kids who live in the area, who are way more familiar with the area, to hear how COVID's been impacting them and their families. And I just have really, really enjoyed the Hopkins HEAT Corps community as well, just to get connected with other people who also have just moved to Baltimore, who have been here for a while, just to see how we've all kind of come together and tried to make it a little less scary, like at the beginning of the pandemic. And now that we're getting to vaccines, helping them have a better understanding of this big, scary thing that they kind of hear about maybe on the news or from their parents, but haven't had a set dedicated time to learn more and more about it. And so, yeah, that's what I've been doing since around August, September.
Thanks so much for sharing, Elle. That's really good. I already have questions, but I'm going to wait on that. So let's just move on to Margarita. Please go ahead.
Okay, hello everyone. I'm gonna share some slides just because I have some pictures to show you about some materials that I've been working on. So see. Okay. Hope everyone is able to see my slides. So hello, everyone. My name is Margarita Correa. I use she, her pronouns. And today I'm going to tell you a little bit about what I've been working on since late October, early November with the Shepherd's Clinic, specifically as it relates to developing a vaccination education and community outreach program. And so just to tell you a little bit about the Shepherd's Clinic, this clinic is located in Baltimore City near Clifford Park, and it serves around 9 zip codes in the city, and it primarily serves adults that do not have health insurance. And so the whole purpose of this project actually came before COVID, and it was basically related to what the medical practitioners in general were observing about low vaccination rates and hesitancy and kind of like misconceptions about what was then specifically the flu vaccine. That was the main concern. But of course, now things have shifted a little bit to the COVID-19 vaccine, but still the program was based on trying to provide information and resources to the clients served by the Shepherd's Clinic. And so with that in mind, the description of the project that I have been working on had like 4 main big overarching goals. So the first one is just to inform adults about routine vaccinations, what is needed, what type of key messages are important to address hesitancy or reduce vaccine hesitancy, and hopefully lead to increased vaccination rates in the community or in the clients served by the clinic and the community overall. And then in the long run, prevent disease. And so what I've been working on mainly is trying to identify evidence-based approaches to inform the community in ways that work. And so, of course, this has been a practicum that has been fully virtual. And although I have not had the opportunity to directly interact with the community, I have been involved with the clinic staff and a very close relationship with my preceptor. And through the reflections that we've had through our weekly meetings and the meetings that I have been able to attend with the clinic, I've been able to gain some insight on the community needs and how to kind of like target my work to help address these main questions. And so just to point out some of the materials that we made, so we're primarily addressing adults. So we thought that a way to reach them would not necessarily be Instagram or Facebook, although we are trying social media as well. But we thought a little bit about going back to the good old postcards and try to send that in the mail. And so this is an example of that postcard. And basically what it has is key messages. And so one of those is protect yourself, your family, and your community. And there is ample evidence that shows that that is a very important message to recommend a vaccine, and just strong recommendations to get vaccinated. The back of that postcard will have like the adult routine immunizations that are needed. And again, the importance of getting vaccinated. And also a very important message pointing out that vaccines are safe and that they're effective, that there is ample evidence that shows that it is safe and effective. Also, I'm not sure if you're seeing my pointer, probably not, but in the uppermost vaccination services, so that's an insert that I've been working on that will go with a vaccine or a clinic brochure, basically just showing what the clinic services are. And what that includes is why get vaccinated. So basically messages of avoid missing work, avoid losing your job, or avoid hospitalizations, etc. And then the one in the bottom is basically just showing a video that we've been trying to show in the waiting area that just basically repeats and sends messages about key adult immunization vaccines, why is it needed, what diseases are they preventing. And again, a very important message is just encouraging the patients to ask their nurses or their doctors in that visit about what vaccines are right for you. And so, of course, we've now switched to the COVID-19 vaccine. And here it has been really important for us to send a standardized message throughout Baltimore City. So we've been working or using materials from the Baltimore City Health Department to make sure that the message that is being sent is clear, that it's standardized, and that all of the community is basically receiving the same message. And so this is just an example of, again, those messages that we've been sending in the waiting area. These are also flyers that patients can take, and it's just addressing frequently asked questions about the COVID-19 vaccine. And this is just an example, what is the COVID-19 vaccine? There's questions about safety, about continuing to social distance, et cetera. And again, the recommendation to talk to your nurse or doctor about the COVID-19 vaccine. Another very strong campaign that's been going in Baltimore City is using important personalities, I guess, for the Baltimore community. This is the fire chief, the fire department chief in Baltimore City. And it's basically a picture of him getting the vaccine and key messages to encourage people and build that trust. And so this is just more recently, and this is what I've been continued to work with the clinic as a volunteer now, and is just basically keeping them updated about how COVID-19 vaccination is rolling out in Baltimore City, how to help sign people up. It's important to know that these patients don't necessarily have access to the internet or necessarily know or want to access this website. So we've been trying to work in partnership with clinic staff to try to basically guide people through the sign up vaccination and address any questions that they may have to be able to hopefully address vaccine hesitancy and encourage them to make informed decisions and get the vaccine. And so I just want to end up with two of the things that I've learned throughout my experience. I just want to mention that I come from a very different background that had zero community-oriented work. I am a lab scientist, so I was in my bench all day long, not interacting at all with any community-oriented issues whatsoever. And so for me, it was very hard to believe that people would not want to get a vaccine. Like, why wouldn't they want to get a vaccine? But through my experience, I have learned that it's not that simple, and that you have to work towards building trust. You cannot simply walk into a room and yell vaccines are safe and that's it, everyone get a vaccine. Clearly, that's not the way it works. You need to build trust, and you need to do this through communicating with empathy, recognizing that others come from different lived experiences, and that they are very valid reasons to distrust the system and to distrust government agencies and medical practitioners. So you got to work, meet people where they are, and work from there. And yeah, the importance of communicating with empathy and recognizing everyone's lived experiences. And with that, thank you very much. I'm going to stop sharing and take questions later on.
Thanks so much, Margarita. And now we will move on to Amy Jean. Thank you so much.
Hi, y'all. I'm also going to share slides. So just a moment while I share my screen. If you can see my slides, can I see a thumbs up just so we're on the same? Awesome, thanks. So hi, my name is Amy Jean. I use she, her pronouns. I am a MPH student at Johns Hopkins. I've been in the part-time student role for almost 3 years now because I've been working full-time and then engaging in school part-time. And I was really, really lucky and grateful to be part of the Baltimore Community Practicum course with Mindy and Danielle. And that's where I got to partner with Veronica Land Davis, who is Roberta's House's executive director, to work on an emergency preparedness and response guide for the staff. So just a quick note about the project. Roberta's House is a family grief support center. It's just really an incredible place to be. And they just moved into a new building, which you can see a picture of there. And as part of this sort of like responding to the pandemic, which is an emergency, and then also having a new space, Veronica was interested in equipping her staff with sort of a holistic guide to here's what emergencies look like, and here's how we might be able to respond to them. And from what I can tell, it's kind of the first of its kind in that family grief support centers don't necessarily have guides like this, but schools and institutions like hospitals do. So I did a lot of reviewing that sort of literature, bringing it to Veronica, and iterating based on the needs of Roberta's House staff. So I just wanted to highlight the goals because really my goal always when I'm in some sort of volunteer role is to build relationships. And I think my biggest long-lasting takeaway from this experience will be my connection with Veronica and the way that we got to collaborate and be creative together. And then of course, the second goal was to create the guide, which I'll show you some pictures of in just a moment. And it's a little blurry because it's from their website, but again, like the reason for me for volunteering is for the people. And so this is a picture of Roberta's House staff, and Veronica's like up at the top to the right. So here's an example of what's included in the guide that I made. I'm showing this in particular because we really wanted to ensure the guide was trauma informed, because a lot of the folks coming to the Family Grief Support Center and working there are either experiencing or have experienced trauma. So what does it look like to know that a crisis is happening, to feel like you've got the toolkit and the tools you need, but then to also feel really taken care of. So this is an example of a worksheet that's in the guide that folks could sit down and fill out together with their teams in order to think fully through what's the best way to communicate, what's the best way to take care of each other afterwards, what do we need, and then also to sort of have a way to store information about what staff and community members have gone through. And I also included some nice little infographics, and this is one that I really love from the CDC, which is just sort of walking us through what a trauma-informed approach is. And so how do we make sure that we are transparent, that we're sharing trust, that there's peer support, that there's collaboration and empowerment, and that there's cultural responsiveness while we are both like working with organizations to build guides like this, but also responding to emergencies. So just a little snapshot of what's in the guide. I have a lot of reflections, which I think we'll be able to share during the panel, but sort of the biggest one for me is that there's a lot of value and responsibility in volunteering and being part of a civic servant professional world or relationship. And I believe that that responsibility is to build meaningful, transformative, and humble relationships with folks, and to do it for the benefit of both people, and to know that we are like all approaching volunteering or collaboration with expertise, and that when we can bring our expertise together, that's when cool things like an emergency response and preparedness guide can be born. Just some plugs with this contact info. I really love Roberta's House's Instagram. That's Roberta's House MD on Instagram. And Roberta's House is always looking for volunteers, not necessarily to make a document in the way that I did, but if you're interested in sort of grief and family support, you can check them out at robertashouse.org. And that's all for my slides.
Wonderful. Thank you so much, everyone. So it was great to hear from all three presenters, and I would love now to open it up to any of the participants who might have questions or comments for someone specifically or for the whole group about anything that's been presented here. So if you want to take a minute and type into the chat, or we're a cozy enough group, I think you could just unmute yourself or raise your hand, whatever you feel comfortable with. I'll give a few seconds for that.
I'd like to ask a question of Elle. I'm Taylor. I'm also a part-time MPH student, and I'm based in Baltimore. So Elle, I'm wondering about, with your experience as a new Baltimorean, what types of things surprised you, like learning about the Baltimore City context with working with your students versus what you expected?
I think that one of the things that I was definitely a little hesitant about, given the fact that we were going to have to be virtual, was the expectation of students. And this wasn't necessarily related or connected with the being a Heat Corps volunteer, but just in general, that students in Baltimore public schools would have access to a device for 8 hours a day to do Zoom classes. And for like my previous teaching experience was in Mongolia, where virtual school is not really possible. And I was also in the Gare district, which is basically, think of like if you have a city center, outside of that city center, there are gares or yurts, and that's where the family lives, and there's typically not running water, let alone Wi-Fi. And so, for example, Mongolia and during the pandemic has not been able to do virtual school and has basically taken a pause and accepted that there is going to be a pause during the pandemic, and when schools return, they'll figure it out. But so coming into it, I was really curious to see how the teachers were addressing that. And going into classrooms, some students didn't have a video camera, and it wasn't that they weren't wanting to be active or participating, they just didn't have access to one. And so it was definitely a learning experience on how to engage everyone, despite what they did or did not have available. And sometimes they were using a phone, so like they couldn't always see the slides. So that was really helpful, where we quickly realized that and would send it to the teachers, who could then send it to the students, and then they could print it out. But that's also with the expectation that they have a printer. And I don't even have a printer because, right, there's too many things to do that we need to print out for online school. So there are just like lots of technology hurdles to come over and overcome. And yeah, so that was I already had some expectations coming into it. I was just curious to see how it would work out, but it was really cool just to see how problem solving came into play, and that teachers were super patient, because I think that was really important, where they weren't getting frustrated with students. If they would ask if they had access to the webcam that day, and sometimes students would be like, no, my sibling's using it today, or etc. So it's one of the issues that I'm sure I feel like there are a lot of New York Times opinion pieces now, and even some data has been collected about the difficulty in access. But yeah.
Yeah, that's pretty wild. Thanks for sharing that.
I had maybe a quick follow-up question for all of you, but first for Elle regarding, you had to work with the teachers, and you also had to prepare this like 30-minute curriculum, each time. And so did you actually structure it from the beginning, to sort of say, we're going to cover this, or did you sort of go with the flow a bit to see what would be most relevant for a particular week?
So we had a great training, basically like a few hours of training before we were even allowed into like the virtual classroom. And I would say that we were trained really well, and there was a lot of great examples. And we had slides that were already made for us, so we were not in charge of that aspect of content creation. We just had to share the slides and talk and hopefully engage students. And so for the most part, that portion was pretty easy to follow. The questions portion was more go with the flow, see if students are really, really concerned with how to get snot out of their masks versus like wanting to know the importance of masks, and stuff like that. So that part, I mean, you're dealing with kids, and especially younger kids are going to ask the weirdest questions, and then high schoolers are going to get really focused on one thing that might have nothing to do with what you talked about, but somewhat related to the pandemic. So I think it was a good balance of very structured, and then if you got through the curriculum part or the content part fast enough, then you're gonna have a lot of time for random questions and more classroom management, like getting them back on focus versus talking to each other about random things.
Great, thank you.
I'll chime in with a question. First, I want to thank Elle, Margarita, and Amy Jean. Thank you all so much for sharing your experiences. I had the distinct pleasure of working with all of you throughout this academic year on your community engagement activities, and you are all absolutely amazing, and we can't thank you enough. So just wanted to share that. I did want to ask you this question. I'll put it out to all three of you. We certainly have some students that did participate in community engagement virtually this academic year, but there's probably tons of your classmates that did not do this experience. What did you take away in terms of your public health development because of your academics? and your experience here with community engagement, and what kind of advice would you give to others when we're talking about the next group of MPH students that are going to be joining us? What would you tell them?
I can get us started. So I think, and this is connected a little bit to what Amy Jean mentioned about the importance of partnerships and the importance of working in collaboration with the community and your community organization. So for me, I mean, being virtual, of course, and being kind of like away from the setting, it was a little challenging at the beginning, and I was a little scared in a way, but just finding ways to interact and finding ways to communicate and engage with the community-based organization. Like there's tons of work to do, and they need help from people like us. So as Amy Jean also mentioned, like bringing what we have to give and what they have to give, that kind of like collaboration just makes great results. And I thought for me that was a great learning experience, the partnership building part.
Can I just add on top of Mindy's question? Because I think, now put all of yourselves back, right, to a year ago. And we were, I'm going to say the collective we, right? We were struggling with, oh my gosh, all of this work with the community is within the community, face to face. And so now, what would you tell an incoming student who wants to work with the community? And we're not going to be really opened up, yet in the summer. So can I just rephrase, Mindy's question just a little bit to ask all three of you what you would tell a new student?
I'll share a little bit. So I actually was super reticent to have my practicum happen during the pandemic because I was really excited. One of the main reasons I came to grad school actually was to be able to work in person with aging populations. And of course, once the pandemic happened, I knew that that wasn't going to be a possibility. And so I sat with myself and I was kind of like, should we just stick it out for another 2 years until I can like get back in person? Like, this is why I wanted to be here and do this. And then I actually think that like being a part of community collaboration in a virtual world and having to see the way that we iterate and we innovate and what it looks like to be intentional in relationship building on Zoom calls has been invaluable. And this will not be the first emergency or pandemic that we go through. And so I think like the skills that I have now to know, like at the beginning of each call, we just connect as people and then we jump into the project, or the accessibility, like the awesome accessibility innovation that's happened during the pandemic so that folks who maybe couldn't meet up in person can connect anyways, because now we have better access to Zoom technology or whatever. I think beyond the like crucial part of public health that is being with the people that we serve and are here for is also being really innovative and dealing with ambiguity and rolling with what we need to. So this has been a really fun practice in that. And that is a big reason why I would say, go for it, even if it's not what you pictured, because it's worth it.
I really appreciate what you're saying and the theme of kind of intentionality coming out of all of this and that really reflective piece. It almost seems like in some ways the pandemic has unfrozen certain norms about how we engage with people, and it requires you to say, okay, I have to do something differently. And because you have to do something differently, you think about intentionally what you want to do in that new space, which I really appreciate.
Yeah, I think I knew coming to Hopkins that while there would be multiple research opportunities, and that in the MSPH program specifically, our second year is more dedicated to an official practicum and capstone thesis project. And so I knew in my first year, I've always kind of been involved in some sort of volunteer activity. And again, just coming back from a volunteer experience, I wanted to see what opportunities there were. And I I think just the fact that we were getting bombarded with emails, but the source emails would always come and be like, there's this opportunity, here's the training, you can do it before class gets crazy. And being a new student, it was a little intimidating to kind of agree to a volunteer requirement of, I think it's like, we were trying to get to about 8 hours per month, 8 to 10 hours per month if we could. And so I did talk to my advisor and was like, is it possible to do this if you're also doing research and taking classes? And I think honestly, a big reason I ended up going for it was because we're online. Time management is so much more fluid and we have so many different opportunities to kind of squeeze things in. And I will say watching recorded lectures can be exhausting, but because they're recorded, you can do things that are real time or live and have that schedule and then squeeze in your recorded lectures whenever. So that was a big plus that was kind of highlighted in, I think, one of the intro talks of like, just squeeze it in when you can, like you're going to meet the requirements, we're not going to be upset, and like we just appreciate the help. And so it kind of let me build my own schedule, which honestly, if it was in person, it would be way harder because you would have to travel to a school and block out way more time than just 30 minutes, 45 minutes to do an online class. And so that personally, with the added fact that you get more experience working virtually, which right now it seems like that is what we're going to be doing for a little bit, even with vaccines coming out, were two really key draws to like trying virtual volunteering, even if it doesn't seem intuitive immediately, because you can find ways to connect over Zoom. And so, yeah, that was a big thing. And I mean, we get source emails like every week. So I think that was a great, because it just kept popping up and it was like in bold red letters, like the deadline's fast approaching. And I was like, okay, you got to make a decision. You'll enjoy it. And so that personally was just really helpful to just take a second and be like, okay, you can make it work. And time management, they'll help you out. And I think those were the key messages personally I needed to hear to be like, okay, like I can squeeze this in and really enjoy it and get to connect with a new community that I was moving into.
I feel like it's worth it to just take a pause to share appreciation for Mindy and Tony and all of the folks who make Source happen, because clearly the three of us on this panel today, like it just has changed the way that we're able to partner with our community and experience our public health program and go through our emails and see those source emails that are like clear and constant. And like all of this is coming together in a way that I feel really grateful for. So just shout out to the Source team.
Thanks for that, Amy Jean. And we have a couple of other Source team members that are on the call. I see Kiala, Vanessa, and Ezat. Ezat's the one that puts out the scoop every week. So Ezat, keep up that clear and constant communication. It's working.
I do have a quick question. I'm an unapologetic Baltimorean, and so I know that a lot of folks come to Hopkins and aren't exactly from Baltimore. So I was just wondering, even in a virtual sort of reality, you probably came in with a certain perception of working in Baltimore's communities. And I just wonder, like, even though all things were pretty much virtual, has your perception changed about working in Baltimore and the community of Baltimore, or maybe it even enhanced the way that you thought about the Baltimore community? I'm just, interested in your thoughts on that.
I'll just quickly say that I've worked in a few schools and a few places, and working with kids is always interesting, but I gotta say, these kids are funny. They are like, they're pretty witty, and they just honestly are so grateful. And that's been really cool to just see, like, they're, for the most part, pretty respectful of the fact that we're taking time to come into their classroom and aren't their teachers. Like, yes, there's shenanigans happening, but for the most part, they're just super cool and excited, and they oftentimes want to change the topic from COVID to like get to know who we are and be like, wait, where are you from? Like, what do you think of Baltimore? And that's always honestly just, it's nice to see how respectful they are, but just like that they're trying to engage with us. And I'm from Atlanta, and I've lived in a lot of different cities and worked in schools in multiple places, and it's just been really nice because some kids aren't as engaging. And so, yeah, I think that personally, it's just been really cool to see that part of the community and just to see the interactions between the teachers and the students. Like, they obviously care about their students and understand and recognize how difficult school has been this year.
I think that throughout my interactions with the clinic, my experience has been fully enhanced. Like, I admire immensely all the work that they do for the community and how they meaningfully engage with their clients and just try to make their lives better in so many ways. So for me, it has been really empowering. I am an immigrant and I moved to Baltimore, to the Maryland area about 8 to 9 years ago. And so although I've been close to Baltimore, I've never actually engaged with the community. But this was an awesome learning experience for me. And I feel like I've grown immensely, and I'm looking forward to continue to volunteer and just be engaged.
I guess I'm a little biased because I decided on Johns Hopkins ultimately because I loved Baltimore so much. And as a part-time online student, I didn't even have to be in the city, but I visited Baltimore and I was like, oh, this is like, I could be here forever. And part of the reason I feel that is because Baltimore is like lively and friendly and resilient, and the communities show up for one another. And so if anything, seeing the way that that presents itself in a virtual world was really cool. I think a good example is that Roberta's house held a virtual dance party with a like world-renowned kid DJ to celebrate the resiliency of youth who have experienced loss and grief. And so as part of just like getting to know Roberta's house, I hopped on this call, and there are kids from all over the city in their homes, just like grooving to this DJ. And to me, that is like, that's exactly what I anticipated from Baltimore. And it's lived up to that sort of like beautiful, we can do this, we're in it together way. And I'll also say there have been some really cool ways to volunteer that aren't virtual that I've been happy to engage with. Like, there's a lot of community fridges popping up around Baltimore, sanctuary cities doing a lot of really awesome support of immigrants in the city. So I think there are also really cool examples of how Baltimore shows up for itself, even when it needs to be like masked and 6 feet apart. There are still ways to be involved and volunteer. So I love Baltimore. I think we all do.
I appreciate all the Baltimore love too. I'm right there with you guys. One other question that I was thinking about is, as you have interacted with your supervisors, your mentors, the students, all of these different folks that are your connections to the community, have they given you any feedback about practices that they really love or that haven't worked well for them in the past, just as a way of sharing that with other people? I'm thinking about best practices in general with the communities in your specific experiences.
I can hop in, and I could make this a continued love fest because the preceptor that I worked for, Veronica, to me was just like an amazing role model of best practices. And even if we weren't necessarily discussing them explicitly, she was warm and consistent and open to being curious about me and to answering my questions when I was curious. And I think by just sort of like showing up as she does, which is both strategic and really kind and familial, she showed me just some best practices and relating to each other and to the community. And I'm sure I could think of some more specific things that we did talk about, but I do think the opportunity to like work so closely with an executive director of such an incredible organization allowed me to sort of gain a role model and think about what practices she was doing just organically that I want to take from this experience.
I guess I would add to that same through my preceptor, we had weekly reflections, as I mentioned, and she was always asking me what I wanted to learn, what I thought, what questions I had for her about her work, her community, it said the community work she does, etc. And I mean, since for our project, our goal was to, how do we build trust? How do we provide evidence-based or whatever knowledge that people can use to make informed decisions about getting a vaccine or not without feeling like they're forced, without feeling like actually encouraging them to take decisions by themselves. So with her, again, it comes to she always mentioned the importance of building trust and how in the clinic, they have very few issues with patients because the connection between the patient and the provider is so close and it's like a family. So for me, that has been really meaningful as someone that is trying to get into the cancer prevention field and trying to work with people and basically having better lives, better outcomes for cancer, et cetera. Just knowing how to build those connections with the patient in a meaningful way has been one of my most important learning experiences, I would say.
I was gonna do a one-word answer, but then realized maybe just the flexibility, how important it is in the implementation, especially virtually, I think was the biggest skill. I think anytime you're doing a lesson plan, and I'm sure the professors and teachers on this call can agree that you have to kind of go with the flow at some point. You can know what you want to talk about, but you can't anticipate everything. And I think especially online, there's going to be technical problems, there's going to be issues, you're going to have all sorts of things thrown your way. And so that was a big takeaway, and something I really appreciated that we got some training on, and then just not only doing it personally, but seeing others who are Heat Corps volunteers facilitate while I co-facilitate, just seeing how they handle those situations has been really a great learning experience that I'm glad I got to have during this year.
It does occur to me, this is just more of a comment to your point, Elle, it does occur to me that engagement virtually versus both in the teaching world and also in the general engagement world requires a completely different skill set than when we were in person. So the flexibility is key, but also like ways of doing comprehension checks and ways of stimulating engagement with community partners and like ways of facilitating discussions and facilitating dance parties. It just requires a completely different skill set than when we were in person.
Yeah, I agree with that point, Taylor. And I think also that skill set, even though it's been kind of forged at the fires of this year, can be something that we bring back to post-pandemic times, right? That kind of creativity and innovation is something that can refresh what we had been doing before and bring new perspectives to it. So I like that part of it as well.
I think just to add on to what Laura just said, we will be carrying some of these methods, into the future. And we have found out in particular that our part-time students, so Amy Jean, and Taylor, we didn't have Zoom accessibility to seminars before. That will happen in addition to having these relationships with the community. And so I think, we've learned, it's been a struggle, right? But we've learned a bit. And I think, the extensions, the many different extensions are going to be used and felt in the future.
Well, this has been really great. We're getting close to the end of our hour. Are there any closing thoughts or questions from anybody?
Well, I just want to personally thank Laura, for bringing these connects together, and for this particular trio of connects to be co-sponsored by Source in the National Public Health Week. It's been a real pleasure to hear all the work that's been going on, and to know that Source is alive even during the pandemic, and looking forward to the coming year as well. So thank you all the presenters and everyone on this call.
Just a ditto with that. Thank you again to all our presenters and to Laura and the Anna Baetjer Society for co-sponsoring this today. And I did add into the chat that you still have an opportunity to participate in some other activities that we have for National Volunteer Week. And so make sure that you go look at the other activities that we have throughout the week. And if any of you have been actually doing some service in the community, just another reminder that you should report and track that service. So please make sure you go and do that. And again, I just want to thank everybody for being on the call today, being on the Zoom today, and for our participants for sharing everything that they've done in Baltimore's community. So thank you. I guess if anyone else doesn't have anything, I want to just thank you all. We will end the cross section for today. And again, we hope to see you throughout the rest of the week for National Volunteer Week. Thanks again for all that you did.
Thanks, y'all. Take care.
Thanks,
Bye.
everyone.
Thank you, everyone.
Thank
Have
you.
a great day.
Thanks, everyone.
Too.